United Kingdom shows that 6% of all cancers may be attributable to x-rays. So
wow.
we have to start looking at this information from all over the place, put it together, look at how many women and men are having multiple x-rays, and start really understanding what the true risk is. No one's done that yet, and we have to start thinking about that.
So the bottom line is no X-ray exposure is really a good one, even if it's considered a safe level.
Correct.
One of the other things that critics are charging is that the very act of compressing the breast may release a tumor, a cancer cell or cancer that has been perhaps encapsulated by the body.
There are lots of things that can turn cancer cells on and off. And in this fellowship that I had started recently down in Florida, Integrative Cancer Therapy Fellowship, this information coming from Harvard, Yale, Tufts, MD Anderson, from Europe and Germany, there's so much more that we need to know now about things that turn cancer cells on. And a cancer cell can escape from its original area, go sit somewhere dormant for a very long time and really not do anything until something turns it on. So the potential for cancers to spread, even the same cancer to come back many years later, is absolutely there. So we have to talk about detection, self-examination with women, learn about your body, test your vitamins, look at some of the great studies on curcumin as an anti-cancer nutrient. So there's really a lot that we want to talk about.
But also, it's a known fact that trauma to the breast increases the risk of breast cancer.
Oh, okay.
But just when we ask the history of a patient, did you have a trauma to the breast? Well, if they say yes, let's say a car accident with the seatbelt just traumatized the breast. Well, that specific person would have a higher risk. Well, here we go every year and traumatize the breast because it's part of the procedure. I mean, it's no secret that the majority of women will say that the amount of pain that they're being exposed to, caused by this, is pretty excruciating. I mean, I've seen patients with black and blue after mammography, so we have to consider it that it is a trauma, repeated trauma to the breast, which, again, as we know, increase the risk. So we have to be cognizant of that.
Okay. We need to take a break, but when we return, we'll be back with recommendations on how you can protect yourself from breast cancer. So don't go away. Welcome back to Long Island Naturally. We're back with doctors Chris Calapay and Moshe Deckel. They've got some tips for us on preventing cancer in the first place. Now, I know both of you physicians put your patients on supplements, and I don't mean multivitamins. Sometimes people think multivitamins, I take my vitamins. We're talking about supplements that are used in high doses as almost as a medicine, correct?
Correct.
True.
Dr. Calapay, give us an idea of what some of the basic supplements women who are concerned about their breast health should be on.
Well, I think a multivitamin is a good idea because it will give them some of the C, some of the minerals, etc., help to enhance immune response. Vitamin C can help to quadruple killer cells. So doing a blood test to see what your vitamin levels are is the most important thing.
Right.
Putting
to get
people
that
on
blood test to
appropriate
see what
multi.
you need.
If you look at the latest research coming out of a variety of studies, curcumin is very, very, very important, especially as an anti-cancer nutrient. It helps to inhibit apoptosis, some of the steps that cancer takes to grow. Curcumin can inhibit, melatonin
Turmeric,
can inhibit.
which is also turmeric.
Correct.
Right.
There are mushroom extracts, reishi, shiitake, maitake mushrooms. Mushrooms should be in the diet, but you might also want to take a mushroom extract combination pill. And there's mainstream medical research about melatonin, the mushroom extracts, and curcumin. Quercetin is beneficial. Vitamin C also has some significant benefits. So there's lots of
And
studies.
vitamin D3 we've heard
Correct.
about.
Vitamin D,
right?
very
I'm sure
important.
there's a
Very
long list.
important.
Dr. Deckel, I know you have quite an extensive protocol. I'm going to be posting it on my blog. But part of that is diet. Apparently there's evidence that women with lower insulin levels have a better outcome. So I assume that you talk to women about their sugar intake.
Oh, absolutely. Because again, as we know, cancer metabolizes only sugar. So if our diet is high glycemic index diet, in other words, with the whites, the sugar itself, of course, but white bread, white pasta, white potato, that increases our blood level of sugar, which of course increases our chances of allowing cancer to develop and sustaining it. So having a low glycemic diet is very important. There are a couple of other supplements that I like to, in addition to what Dr. Calapay just mentioned. One of them is DIM, diindolylmethane, which helps us get rid of estrogen in a healthy way. Okay, that's one. Another one is sulforaphane. It's derived from broccoli seeds. Tremendously, actually studied done by Johns Hopkins, show that using that specifically helps prevent and also treat both breast cancer and prostate cancer. Also iodine. Iodine is tremendously important. Japanese women have the lowest breast cancer in the world, and they have just enough seaweed every day to get them enough iodine. And the relationship between iodine and cancer are just inversely proportional.
Interesting. You know, one of the points we haven't made yet, and we're running out of time, is that a thermography or a digital infrared scan allows a woman the opportunity to take action. If you see something that doesn't look right, there's an inflammation or there's something developing, then a woman can do something about it, right? She can correct her diet, she can start exercises, she can take some of these supplements.
Absolutely.
That's exactly the point. The problem with mammography is, in my opinion, is that by the time we see something, we have a problem. Thermography, on the other hand, can tell us what risk we have, and if we have an increased risk, let's use the protocol, let's change our habits, let's take the supplementations Dr. Calapay mentioned, etc. So we reduce our chances, don't get the cancer. And by the way, the protocol we give is not just for breast cancer.
Yeah,
It's
I'm
cancer
afraid
in
we're out of
general.
time. Thank you so much. This has been great.
Thank you.
And thank you for watching. For Long Island Naturally, I'm Mary Musi. Enjoy the rest of your weekend.
Great.
Fast.